welcome to a special edition of What's Happening. I'm Elliot Margolis. I'm hosting the show, and I'm here to talk to a good friend of mine and author of this new book, How to Reduce Your Chronic Pain. My friend, Dr. George Beilin, he and I have been friends for a lot of years. But this book is something that George has been working on for quite a while. He's coming out with a second book soon about chronic pain. He's a psychologist here in the city of Beverly. And I bought the book from George because, number one, because he's a friend. And number two is always hoping to educate myself a little bit. So I get maybe 3/4 of the way through the book, and George calls me up and he says, "So what do you think of the book?" And so I said, "Well, I'll tell you, George, it's very interesting, it's fascinating, but it's kind of irrelevant to me because I don't have any chronic pain." And George said to me, "Everybody suffers from some kind of chronic pain." So I guess my first question to you, George, is how does everybody suffer from some kind of chronic pain? What is chronic pain?
Well, I can't even respond to that now because I look at your color of your shirt and I feel very relaxed. So, my anxiety level in terms of pain from emotions is very low, like about a 1, because I can go to sleep looking at your shirt. But what I was sharing with Elliot was that when we first look at chronic pain, and especially from the medical community, we're really talking about physical pain, and initially. So when you talk about chronic pain, you go to your doctor or your nurse practitioner. They'll say, "Okay, what's your pain level 1 to 10, physical perspective?" Well, we've come a long way, and the medical community is recognizing that chronic pain is not just physical; it's multidimensional, it's subjective. And so when Elliot asked me this question, I said I knew he didn't read the whole book yet because it's basically the chronic pain, and I know he was going to ask me this question, is the ongoing experiences of challenges in one's life, whether they be physical discomfort, that's one, confronting one's life stressors, handling difficult emotions, having negative thinking, negative thoughts as symptoms related to pain, or having, and this is becoming much more of a concern for our society, a lack of fortitude. We used to call it ego strength, but this is a big one for me in my book about how to help empower people to have greater ability to tolerate frustration, disappointments in life, delays of gratification, which I hope they learned. Remember, Elliot, pain has been a good thing. It's not so bad. We've all experienced pain. You can't tell me anywhere that someone as an infant didn't feel like they wanted to cry because they were in pain, because they were hurting and they wanted their mother to change their diaper, or their parents left them for a little while. So we're looking at pain as a metaphor, really, much more than just physical pain.
Well, what would you consider, well, first of all, let me ask you, why did you write the book?
Okay, so I have my professional experience and I have my personal experience. My professional experience is, I've been practicing since 1978, so I'm a seasoned psychologist here in the city of Beverly and in North Shore, well respected, I hope. I get a lot of referrals over the time. I have my doctorate. I've done work as a pain management psychologist, chief psychologist for a local pain management center. And then I ran a group for pain patients and their caretakers for 7 years. And then I said, I got to expand this because there's a lot of people out there. If you see the data, there's 100 million people in the country that have chronic pain, physical pain. That's not to mention all the other dimensions we're talking about. So from a professional point, that was one reason. In a parallel way, like many people out there, unlike you, unfortunately, they were athletes. I was an athlete, a major athlete. I did We were talking about the marathon just came out. It's painful because I think of these guys running and women running. When I did it 3 times in 80, 81, 82. And I was quite an athlete, and I did the back of the pack. It was easier to do then. And then, so I ran, I jogged, I played a lot of tennis and all that. Well, what happened, without getting into the whole details that are in the book, that I experienced somewhat of a traumatic event of having peripheral neuropathy develop as I was playing tennis and running a lot in my 50s, and then I had to stop that, and then I had some traumatic experience with a massage chair, which I don't want to get into right now, and then I had an emergency surgery. I had basically 6 surgeries in 7 years, starting in 2018 December, 4 neurosurgeries on my back, including a spinal fusion and an emergency cervical laminectomy, and then 2 hips. So I'm a hip guy, and I'm a bionic person right now. So.
Okay, well, first I want to correct you. I was an athlete. I used to play doubles tennis at Beverly High School, was undefeated.
Oh, I thought you were an athletic supporter.
That's just, I just thought I'd get that in.
Okay.
But when we talk about chronic pain, you list, like, there's about 10 different facts about chronic pain.
Yeah.
I don't want to go through all of them because we don't have enough time.
Right.
But you talk about chronic pain having different intensities, that it's multidimensional. Mm-hmm. Explain that a little bit, and because I'm not only that, but I'm wondering, like, does people say, is depression considered chronic pain?
Yeah, pain. Yes. So let's get to the first one about the intensity.
Yeah.
So everyone's had pain since birth, and it's not that you had pain, it's the intensity of the pain that's different for people. Unfortunately, many people have had traumatic experiences, and there's a high correlation between post-traumatic stress disorder with young age, intensities of trauma, and pain, physical pain. That's only one dimension. So when I talked before about the healthy aspects of pain, when the intensities of pain have been too much over time, especially in developmental years, with respect to separations, disappointments, delays of gratification, frustrations, things like that, and traumatic events as we go along, that's where a lot of people experience pain, physical pain, and it's related to that very much. As far as the multidimensional aspects, well, I just shared, I think, at least 5 dimensions, and we're looking at pain as a biopsychosocial perspective. It's not just physical pain. We're looking at all the interactional aspects. So when you say, someone has depression, yeah, that is pain. Rate should, wouldn't it be interesting that the medical community, for all the research it's done, in a very exceptional way, has come down to, for example, an EPIC, which is electronic health record, they ask you, well, what's your pain level, 1 to 10? I mean, that's as simple as it gets. So it shows it's subjective, physical pain. It's multidimensional because, everyone is so different. You won't find one person the same. And so why not ask, well, what's your depression level, 1 to 10? Okay, what's your anxiety level, 1 to 10?
But people don't necessarily think that if they're depressed, they don't necessarily consider that pain.
Well,
you see what I'm saying?
Yes,
so
I
what
understand.
I'm trying to get at here is a definition of chronic pain.
Okay.
And because people, as we talked about, I fortunately don't have any quote unquote physical chronic pain.
Right.
And that's what I thought I'd be reading about in here, as opposed to, the wide range of pain.
Yes.
So,
pain.
It's that definition that we're looking at. Now,
before you go on, just think of the legal definition: pain and suffering. Just thought of that. Okay.
Yeah.
Now, is a lawyer going to come in here and say, "Oh, it's just physical pain"? Ironically, they're talking about pain and suffering. So, pain, suffering. We're looking at the same kind of metaphorical dimensions of pain. As I said, we're looking at life stressors. We're looking at lack of fortitude, which is a big one.
All right. Well, I want to show a page in the book.
Actually, they have a.
Yeah, I know. This page here dealing about coping with chronic pain, And if you could explain it, I think Kim will put up a slide so that everybody can see it a little better than this.
Okay, so on the top it says choosing a pain management lifestyle. This is the hope and intention of my book, which is to look at pain as lifelong, and it has a lot to do with several theories. One of which is related to relapse prevention. That has to do with maintenance. There's pain reduction and there's pain maintenance. So keep it up. Okay, so on one side, basically, you have a situation where you defend against chronic pain, which is one of the facts, which is there are better ways to deal with pain than others. So you can choose. This is all about free choice, too. So if you choose the path of defending against chronic pain or choosing a pain management lifestyle, you're going to avoid, you're going to rationalize, you're going to stay in bed, you're going to cover up and deny that you have chronic pain, like you with anxiety or whatever, and depression and anger regression, blaming people, playing a victim. And here's something interesting that what I found is that people can use pain as a very powerful tool to control their whole family and whole systems. It's an interesting kind of side effect of what the benefits are of having kinds of pain. So you can choose those ways, but they're not the best ways to deal with pain. On the other side, as you see, it says free choice. You can choose to acknowledge that, yes, you do have pain and you're not doing the best ways to cope with or deal with the pain. So then comes a mourning stage that's very realistic. I went through it, crying as I went through past the tennis courts and, remembering my early bird experiences of playing tennis and jogging. I don't jog anymore. I bike, I do other things. But people have to grieve and let go of the way they were. This is a painful, talk about sadness. This is a healthy mourning, if they can choose to do that and accept the reality of situations. And then, here's the beauty. Then you start to see pain as a challenge, as a new opportunity to deal with, not seeing it as a catastrophe or a loss, but as a new beginning with emphasizing resilience. Then you get into a pain management lifestyle, which we can talk about, but if you stay on the left side of this model, you're going to see this circle of chronic pain, physical, that's just, it's terrible. Stress, helplessness, anger, depression, fatigue, symptom exacerbation. You'll stay in that do loop for the rest of your life if you don't get out of it. So, and there's always a potential for relapse, as you see on the right side. That's the relapse prevention model, which is knowing your triggers to get back into that. So we can talk about pain management lifestyle if you want, which is the hope here.
Well, yeah, and you talk about, dealing with chronic pain. And people are going to, like you, or like me, because believe it or not, I used to be a pretty good tennis player.
Yes, I know. I'm only kidding.
But,
I'm joking. Humor is the one on fortitude. You know that.
Oh, yeah. But what I'm saying is, people will say, boy, I used to love to do this, or I used to love to do that.
Yeah.
And it I can't do that anymore, so that creates depression, which is...
Well, healthy depression. Let's reframe it.
All right.
Because it's healthy mourning. Why should Judith Viorst wrote a book way back called Necessary Losses, and that was a great book because it started off with the death of her sister, but she dealt with the reality that all of us go through losses, aging. We can't do things that we used to do, but if you stay stuck there, it's going to be tough. So this is called healthy depression, if you want to say it that way. Helping people work through the loss that, okay, you can't do that anymore, so what can you do?
All right, so some people might cope with pain by drinking to try and forget their pain.
Yeah.
Or taking drugs to try and, how do you cope with that? How do you deal with that? How do you treat something like that? How do you convince people that, life isn't fair. People have different things, and you've got to learn to deal with it as opposed to drink your way through it.
Yes. Well, it's a great question, and I think it's related to the sequel to this for healthcare providers, which is how to reduce your patient's chronic pain. A new way to restore hope, theirs and yours, because of the stress that healthcare providers are going with this. We clearly know that we have an opioid crisis At the same time, there was an interesting article that just came out identifying that of 18 states that have had suicides from a substance, they studied the ex post facto, afterwards. They found that the highest concentration was not opioids. It was antidepressants and alcohol. And if we think we have a problem with opiates, we have a bigger problems with all kinds of passive suicidal ways that people are dealing with things. Alcohol, the Center for Disease Control identified that alcohol increase went 32% above increase from 2012 to 2013. There's a 545%, I may be off, but that's quite a statistic. 545% increase in cocaine use. They didn't say cocaine or crack. They said cocaine use this year. Okay? So we have a lot of people dealing with passive suicidal tendencies that's just beyond opiates. So the way you deal with them is first you have to accept it. You have to sort of acknowledge that they're there. And this has to do with a motivational change model that I talk about. And what you have to do is you have to help people understand what are the benefits of using or continuing to use these. Let's look at these without judgment. What are the benefits and what are the costs? What do you lose? And you help people do the cost-benefit analysis from a business perspective, and help them to sort of understand they can get to the level of change where they say, maybe I should change. Maybe I shouldn't continue this because the costs overweigh the benefits. So you got to go through a stage of change procedure with people like this. You can't just say advice. This is the problem with the healthcare community. You say, oh, you got to do this, and you got to do this. No, people. There's a lot of medication treatment non-adherence. The statistics are very high. People not refusing to want to do what the doctors and nurses tell them to do, or physical therapists, because they resist. They'd rather take a drug or whatever. Okay, so you got to go through the stages of change with person and not be so judgmental with them.
All right. Well, we talked about learning to deal with your disappointment.
Yeah.
Not an easy thing to do.
Not this day and age, no.
We've got lots of people out there who feel entitled to this, entitled to that, and all of a sudden,
yes,
you can't do it.
Yep.
How do you, when you're talking to somebody and saying, okay, I understand you're disappointed, but you have to move forward?
Well, this is where we get to my baby, which is the fortitude scale, which is in here. And one way to deal with lifestyle management is using 5 scales, one of which is already developed for the physical pain scale. But one of the scales, the last one, which you didn't get to, unfortunately, you stopped, is the fortitude scale, and that has to do exactly with what you're talking about. It has to do with the hope and prayer that people have learned way back how to deal with disappointments, tolerate frustration, delay gratification, how to deal with optimism, resilience, learn resilience, and dealing with other things like humor, as we're dealing with, love and spirituality at the highest level here. There you have the list here. Okay, so you have others. And you've gratitude.
Yep.
Yep. You have a researcher, Martin Seligman, who was a researcher in learned helplessness about depression. He turned everything around to deal with positive psychology, and this is really an emphasis for him, his work.
This is an interesting quote from Robert Frost.
Yes.
Robert Frost says, in 3 words, I can sum up everything I've learned about life. And those 3 words are, it goes on.
That's right.
So the point being, you might have pain, or you might be depressed, or you might feel sorry for yourself, but life goes on, so you got to make the best of what you can do. I mean,
and this
everybody has a shtick.
That's right. Shtick is, by the way, Yiddish for an issue.
Yeah.
For those who don't know what shtick is.
And that's the thing I think everybody has to understand. We all have something.
Yes.
Life isn't perfect.
Life isn't fair, as you said.
Right. So
okay? Well, challenges.
We all have issues, and to have a happy life,
as best as possible,
you have to learn how to deal with it, and that's where this book comes in pretty handy.
Yes. Money, by the way, does not bring happiness. You need a stable level of money, but Seligman has showed money does not bring happiness. Gratitude does, acts of kindness do, love, spirituality do. And my biggest concern in this day and age is that with technology advancing so rapidly, people are not learning these skills again. And that's why their pain is exacerbating physically, because they can't delay gratification, frustration, all that stuff. Hopefully they learned it, but unfortunately they haven't. Many of them haven't.
Yeah, and so if somebody comes into your office and starts talking to you about their depression or their, you can easily, I assume, determine that it is some type of chronic pain that they're into. I mean,
Yeah.
you've defined chronic pain in the book as something that continues for 3 months or more.
Well, physical.
Physical.
Yeah.
But mental.
Mental, life stressor, emotional, lack of fortitude, thinking errors, ongoing.
So, and you cover all that in this book. Now,
Yes.
you've got another book coming out.
Yes, it's in the editing stage now, and that's, as I said before, this one is for people who have chronic physical pain and their caretakers. The next sequel is for the healthcare providers, doctors, nurses, physical therapists, chiropractors, etc., to help them deal with people who have chronic pain physically first.
So you wrote this book to help people understand about their pain
Yeah.
and to try and help people realize, gee, even though I've got this, it's not as bad as what other people have, or, you have to put things in perspective.
Well, that's an adaptive thought that's related to people's negative thinking. Mm-hmm. So you want to get people to think that way because they'll reduce their pain. If they think that way from a cognitive therapeutic model, that from Aaron Beck's work, Dr. Beck's work, psychiatrist, that thinking pain exists too. You have a lot of people, and it relates to anxiety, relates to depression, relates to physical pain. So you have to help them develop rational thinking, which is it's been a long-standing issue.
How important is the family in all this?
Very big. And when you say family, we've come a long way from the 50s. I talk about how we've even dealt with spirituality and, between God and a higher power, which is, the family depends on what you mean by family. I mean, if you're talking about a significant other who helps you out with chronic pain, physical pain, that they're included. They should read this book and they should be a part of it. From a family systems perspective, they could be extended family, but we have a lot of breakdowns in family. It's very painful that way from a societal view. So you get everyone involved as much as possible, including community.
How do you, say, recognize that you're suffering from chronic pain? I mean, people don't necessarily think they are. Like, for instance, when I was reading the book, I said to you, it's a nice book, but I don't have any pain.
Physical, right.
Right, but I mean, how do you recognize, does someone's family recognize that this person needs help? As opposed to, it's physical, yes, but mental, a little harder to find.
Yes. So, again, remember, I said pain is subjective. What's your physical pain level? 1 to 10. Yours is going to be different than mine. It's going to be different than this person's. Okay? It's all subjective. Okay? So you will know. We have to take you for granted that your perspective of pain is going to be different. You could have severe stenosis, which is a narrowing of the canal of the vertebrae against the spinal canal, which I've had, and I've had a fusion. Okay, and another person can have the same MRI. Why is it that? Well, we'll take the other way around. Why is it that you can't get out of bed, and the other person can walk mountains? Like, why is it possible? What is that? Okay, that's a subjective view. Everybody has a different view of their own self-pain. So, yes, in doing the scales, the hope is to enhance this area of the brain, which is prefrontal cortex, has to do with self-monitoring, and adding the dimension of other people who know you to sort of figure out, okay, look, are you telling the truth, or you're sort of fabricating issues? So then you get a little perspective of reality from, gee, maybe I'm minimizing things, or maybe I do have depression, maybe I do have anxiety, maybe I don't think effectively, maybe I can't cope.
Well, coping is a big thing.
Big, yes.
So how do you cope?
How do you cope? Well, in the book, there's like multiple ways to deal with each area, okay? I give ways to, physical ways to help you with chronic pain. I give you ways to deal with anxiety, depression, anger, which is often a defense against underlying feelings. I give you a way to increase happiness, strategies based on Seligman's work. And I'm sharing with you ways to change your thinking errors, which are symptoms. Thinking symptoms are just as important as physical symptoms and emotions. And then the biggie for me is how to increase your fortitude, your self-esteem, self-care, self-efficacy, which is a sense of accomplishment. You're big on that. Assertiveness, we're way up past 10, I know you. Okay? So humor, you're getting there. You're about like a 6, 7.
I've been friends with you. I'm learning humor.
Well, I'm 9. You're getting up there, Elliot. We'll keep doing it. And love and spirituality. Spirituality, the biggest thing. Gratitude.
But you mentioned anger, and that's if all of a sudden if you start getting angry at people,
yeah,
or angry, you're trying to do something and something goes wrong, your pen runs out of ink, and instead of just getting another pen, you throw it away, or is that how somebody in your family or friend can recognize that maybe there's more to it than just, there's some real serious pain there? Well,
again, the hope is by your observing yourself, like they used to do videotapes in sports psychology, that you watch yourself, going down, mountains, which I used to do, XX mountains that I don't do anymore, or in racing, or in doing, anything. But if you could sort of observe yourself, develop observing self, that's the best way. And then if you have other people, yes, your wife or your significant other or your husband, or if you're a woman, or whatever, but, it helps the reality test. Okay.
One quick question, because we're running out of time.
Yes.
I'm thinking, I know you've got a nice dog. Does a dog or some kind of a pet help relieve stress?
Yeah, it's interesting you bring that up, because I was at a association meeting a couple months ago, and a professor from Montreal came down, who was a psychologist, and shared with all these other psychologists, including me, about how to deal with stress, with PTSD. And she identified several things. One is how to make you need to help people sort of make the relevant from irrelevant stimuli a distinction. And then she's talked about laughing, humor, walking around, and then a pet. She mentioned you need to have a pet.
All right. Again, George, I want to thank you for talking about your book.
Just watch your shirt.
How to Reduce Chronic Pain.
Yeah.
It's available on Amazon.
Amazon, you can get it from me directly by writing to me, email, and then you can get it online, Barnes & Noble, whatever, through e-books to Kindle.
All right, well, thank you. This was interesting.
Have I expanded your view of pain?
You have expanded my view.
So you're going to read the rest of the book?
I did read the whole book.
No, you didn't. You said you stopped at a certain point.
I stopped when we first, but then after you yelled at me and telling me that...
I didn't yell at you.
Well, but then I
so
did
read...
I did read the whole book.
Okay, thank you.
And I bought another book for my son and daughter-in-law.
And by the way, I bought his books.
So that's fair.
Okay.
All right, George, thanks very much.
Okay.
Good luck with the book, and good luck with your next book.
Thank you.
And we'll talk again soon.
Okay.
Thank you. Good night, everybody, and I hope this was educational for you, and don't hesitate to buy the book. George says everybody has chronic pain, so you do, and this can help. Thank you.